with regard to the principals on the call, as we'd mentioned, it's Dr. Eva King, PhD. Eva's first name is spelled E-W-A, but pronounced Eva, and it's Richard Huard, PhD, H-U-A-R-D. And I'm just going to turn it over to, actually, if Dr. King, if you want to say anything at the start, go right ahead. If you want to take a question, we'll just go right in to the questions. And again, for reporters, just press *6 to unmute yourself because Zoom automatically mutes you.
Good morning, everyone. This is Eva King. I'm the director of the Rhode Island State Health Laboratories, and we're here this morning to answer some of your questions about testing that you might have and the State Health Laboratories in general. With me is Dr. Richard Huard, who is the Chief of Biological Sciences, the Center for Biological Sciences at our laboratory. That's where the COVID-19 testing takes place. So I think if you can hear me okay, I think we are ready to take your questions and answer any specific points of interest that you might have.
Hi there, Dr. King. It's Elizabeth Maximo from East Greenwich News. Am I unmuted? I think I am. Can you hear me?
You are, Elizabeth. Yep.
Yeah. I guess I was just wondering, how different is this, dealing with COVID-19, what you're going through now at the state lab? Are you on a wartime footing, kind of? I mean, is this completely different than how you guys were operating before?
Well, I think it's very different in the sense that we are focusing almost entirely on one test in this laboratory. Our laboratory does so many tests every single day for not only infectious diseases or infectious agents, but also environmental and forensic testing. Not much of that has actually been discontinued, although for obvious reasons, we have the numbers of samples submitted to our laboratory have decreased. However, obviously this is more than compensated for with the number of specimens we receive every single day for testing for COVID-19. That has not, both of us, Dr. Huard and I were here for the first case that we have found in Rhode Island at the very end of the last day of February, and our laboratory has not stopped since. We are operating every single day, weekends included, at extended hours.
Hi, this is Brittany from Channel 12. Would you just be able to describe the process of after somebody gets swabbed through the nasal swab, just kind of how the process goes for you guys in testing and making it positive or negative?
Sure. So the samples are transported to the laboratory, and at this time we are one of several laboratories involved, but the samples would be transported to us and received in our lab and then processed by our scientists. I'm going to turn it over to Dr. Huard, who might want to say a few more words about how the test is actually conducted, but I would like to know that we have involved many more scientists in this process than we normally would from our other laboratories that normally perform tests for STIs or HIV or similar tests. Dr. Huard?
Yeah, so almost practically every person who works in my center has been drafted into the COVID-19 test. We've brought in a former scientist who's now a retiree she's volunteering to help us out. And we've also been able to bring back employees of the Department of Health who worked here at one point, but then lateraled into another positions elsewhere within the department. So we've really marshaled a huge effort in order to do this coronavirus testing. So once the specimen arrives, is taken and is an MP swab, it's put in a viral transport medium. When it arrives at the laboratory, it is unpackaged and then all the patient information is entered into our electronic medical record so that we're able to report back to the doctor of that patient. The specimen is then goes through a process called extraction. In this process, we isolate the genetic material from the virus that's in the specimen. The next process that follows is called PCR. This is a method where we amplify the viral targets and detect them. From that point on, then the results will tell us whether the virus is present or not in the specimen, and then we report out the results.
This is Amanda from ABC6. You touched on this a little bit just now, but do you have all hands on deck, all scientists working on COVID tests, and will you have to bring in more workers as testing expands?
So we have, as Dr. Huard mentioned, we have engaged pretty much the entire Center for Biological Sciences. So those are scientists who are used to working with clinical specimens, which is what these tests are applied on. We have also brought in other people from other centers, those who might be on a normally testing drinking water or testing forensic evidence, such as sexual assault evidence, who have skills that we need them to have to perform this test. But the most need that we have is for data entry and those very beginning stages of the process, what we call specimen processing. So we have been able to bring people in from other parts of the department to help us with that. We might need more people at the later stages of the response, and I would also like to commend our academic colleagues who have volunteered their students or researchers to help us out. At this time, we have not had the need just yet. We are able to work with folks who are available, our employees here, available to us, but the time might come when we will need to reach out to them as well.
Dr. King, Mike Healy, I'm just going to jump in real quick just to help frame this a little bit more for folks, and keep me honest, both Drs. King and Dr. Huard. The State Health Labs ordinarily employs 80 people, I believe, 80 people, approximately X of whom are now involved in COVID. Can you fill in that X, please, for the reporters?
So it's at least 30 of those are directly involved in the response. Others are involved in daily functioning of other functions of the laboratory, which have not been discontinued. So we still testing drinking water to make sure it's safe. We're still collecting air samples for testing. We still have some limited forensic functions in place as well. So there are different roles for us to play, and of course we are also helping out the rest of the response that the Rhode Island Department of Health is responsible for.
Hi, Ed Fitzpatrick here from the Boston Globe. Doctor, I was wondering to what extent you're seeing false negatives with the coronavirus testing. We've in the Globe had some reports of up to 30% false negatives. Do you have any sense of the proportion here?
We don't at this point, but false negatives are a great concern of ours as well. Main problem is this is a new kind of test for a new kind of virus, so the science is still developing. And so whether there are false negatives, I'm sure there are, because no test is 100% perfect ever. This is why we advise everyone we talk to that a negative result does not necessarily mean they're negative. It could be a false negative, and if you have symptoms or continue to have symptoms, then you should consider getting retested.
And to provide some context, the way one can tell whether something is a false positive is only by showing the presence of the disease later on. So that's not entirely clear how that can be confirmed or established, which is mostly by doing further testing. There might be early stages of the disease when a patient is negative, and yet they eventually develop symptoms and test positive. This might be either at an early stage of the infection, or it might be prior to the infection. The patient actually, the person develops the infection and contracts the virus later on. Those are really difficult to sort out. I'm surprised at that 30%.
And a lot of things go into that could be a factor in a false negative result. Besides person having a low viral load at that time for any number of reasons, or it could be, or specimen collection is so critical as well too, and the specimen type is so critical as well too. So there's a lot of factors that go into whether a person would test incorrectly as negative.
Hi, it's Katie from Channel 10. Just to follow up on Ed's question, I know nationally we've heard about shortages of the reagent that you need to run the test, the chemicals that you need, and other lab supplies. How are we doing with that in Rhode Island?
Well, that has been certainly our sore point throughout the response. We are very grateful to the governor who has assigned additional personnel to us to just stay on top of the supply chain because we're using a number of very specialized components and reagents and chemicals to complete the test. It's been a challenge to make sure that all of those components are available to us at any given point. We frequently find ourselves in a situation where we only have a couple of days worth of supplies for a given step of the test. We have not ran out yet completely, although at some point we had to resort to borrowing some supplies early on from the neighboring states. We're doing, I think, okay right now, but that is subject to change literally every day.
And usually when you have a clinical laboratory test, there's only one way of doing it, and you stick to that protocol, same way every time. In this situation, because of the supply chain issues, we've had to resort to using multiple methods to do the same thing in order to make sure that we always had some supply of one particular method over the other.
So we have to be really much more flexible than we normally need to be in terms of which components of the test that we would be using, which equipment we're using on a given day. So that's just something that's part of this response that we really have never experienced before to this extent.
Hi, Jonathan Bissonnette with the Pawtucket Times newspaper. How many tests are being conducted per day at the state health laboratories, and exactly what is the time frame from when a specimen arrives at the laboratory to when a result is available?
So specimens arrive throughout the day. We get them from about 8 o'clock in the morning until 5:30 at night. They being processed and tested as they arrive. The number of specimens that they get reported within, most of them, 24 hours. Sometimes some might need to be rerun, and that kind of delays the reporting process. In terms of the numbers, we have our capacity is about 300. We have exceeded it on a fairly routine basis to 400 or thereabouts. 450, I think, was our record. Other laboratories utilizing other tests might be able to have a more high throughput test online, which doesn't require 2 steps that we have to complete. So those are the numbers that we are putting out pretty much every single day, and have ramped up very quickly at the beginning from single digits to hundreds.
Brittany from Channel 12 here. How has the state lab ever gone through intensive and massive testing like this before, and how has it changed your approach?
So we So in terms of, this is more of an outbreak response than routine testing. We do a lot of routine tests. HIV is something that comes to mind, and various sexually transmitted infections. That's something that we do a lot of on our regular day. Those are usually highly automated. This test that we had to scale up for is not nearly as automated, which is why to perform a lot of tests every single day, we had to involve so many of our staff.
Well, this is very much an unprecedented situation that we've not had, in my memory, such a huge response being necessary for any particular pathogen. I mean, remember last summer we were dealing with triple E, and so we were doing a lot of testing for triple E last summer, but it certainly was not at the scale that we are seeing now.
We are drawing lessons from H1N1 outbreak response, which was at the beginning we thought similar in scale. Obviously, this one eclipses that response by orders of magnitude, but that was our kind of preparation for this type of response. So we have always spent a significant amount of time planning for an outbreak of this scale. Pandemic influenza is something we have been preparing for. It's here now. It's not an influenza strain, but it is a viral pandemic. So that's what we are able to benefit from, the planning stages.
And for this particular virus, we honestly, as soon as we heard that it was being transmitted person to person in China, that's when we started thinking about getting all our ducks in a row. So we've been working on this since January to be prepared.
That's great. And just so I make sure I get this number correct, how many state health labs are there in Rhode Island?
So there is only one public health laboratory, and it's actually a consolidated laboratory that coexists and is co-located with a forensic laboratory, meaning the ones that help the police solve crimes, and a state environmental laboratory testing. So this is it. Other states have local public health departments. In Rhode Island, there is none. So the state really performs functions for both local and state functions.
Good afternoon. Chris Allen. Oh, sorry. Go ahead. Chris Allen from Newport this week. This is sort of a follow-up, but could you talk about your funding sources and is current funding adequate moving forward as you try and sort of make preparations for future outbreaks? Thank you.
So our funding, normal funding for normal day-to-day functions is about $7.7 million in state funds. We get sizable federal grants as well, some of them for the response, for the preparedness and response to infectious disease outbreaks, such as this one. That's another $2.3 million for the laboratories as a whole. So funding to respond has not been an issue for us. The governor's office has made available special funds for this response, which obviously exceeds anything that we have encountered to date. We are purchasing supplies, and we are employing our scientists on overtime basis without any restrictions.
Ed Fitzpatrick here. Hi, Ed Fitzpatrick here at the Globe again. I was wondering what the overall number of tests per day are at this point. If you're doing up to 450 a day, where are the others, and what total are we at, and what are we hoping to get to?
Right. So we have been working very closely, probably closer than ever, with other providers of testing services in the state. That includes all of the hospital laboratories. So some of the tests are being done at the hospital laboratories, especially Rhode Island Hospital. And we have also engaged early on commercial laboratories in the state. Eastside Clinical Laboratories is one of those also involved. So we coordinating very closely to make sure that we responding to the needs where they exist. So some are more routine healthcare. Some are more outbreak related. That's probably our biggest role. And obviously hospital laboratories mostly provide testing for their own inpatients and sometimes their own employees.
Ed, Mike Healy, just jumping in real quick. I'm pretty sure that one of the governor's points of discussion at the presser shortly is going to be on the issue of testing numbers. So I think you'll be able to get some more details about numbers shortly.
Okay, thanks.
Hi, Katie Hamilton again. Question about the scientists in the laboratory. I see there that they're wearing the PPE, they're wearing masks and gloves. Are they at risk as they do this testing, and is that part of why they wear the equipment?
Part of why they wear the equipment is because the personal protective equipment is because that is what our evaluation of the risks indicates. Obviously, for a laboratory, that is not very unusual to be wearing gloves or even a mask, although at this point all personnel in the laboratory is wearing masks as critical employees. So that's for a laboratory visual, that would be pretty common that we would be wearing lab coats, at a minimum gloves and masks. There are steps of the testing process that are more risky than others, and additional PPE is required of our staff.
And all our staff go through extensive safety training and annual refreshers, and we take the safety of our employees very seriously, and it's our primary concern. So we take a lot of steps to ensure that testing is done in a safe environment.
And one thing that you might be seeing in some of the photos is that these tests are not done on the benchtop in the laboratory. We have what we call biological safety cabinets. That's where additional safeguards, engineering safeguards, are put in place to make sure that working with these, many of them positive specimens, is not hazardous to the workers.
This is Amanda from Channel 6 again. Since we couldn't go on the tour, are you able to just give us a run-through of what we'll see through this footage, what we'll see walking through virtually through the lab?
Yes, I think what you will mostly see is the steps that Dr. Huard has just described. So from the receipt of the specimens here through the extraction process and working on opening up the bags that the specimens come in, and a huge effort required in making sure that the patient's names and demographics is logged in our system, and those specimens are properly labeled. Then they get extracted, and then they get the RNA, viral RNA gets detected on a piece of instrumentation that you will see in the photos and the footage. So we basically led
You are unmuted.
The cameraman through the testing process.
Thank you. And are you able to tell us the process of once someone tests positive, once they're told to quarantine, what the contact is between the Department of Health and that patient from that point forward?
So that's really outside of the laboratory scope of work. We transmit our results to the Center for Acute Infectious Diseases and Epidemiology. Those are the staff who are responsible for contacting the patients and tracking down their contacts to figure out whether their contacts need to be tested. So that's very important work, but that does not happen at the laboratory. That's outside of the laboratory within the Rhode Island Department of Health.
Dr. King.
Hi, this is Paul Zangari. Hi, Paul Zangari at WPRO. Dr. Huard, you had mentioned earlier how you had brought in extra staff. I'm wondering if you can tell me how many people you've brought in from other agencies or people who might have been, say, retired and are coming back in, if that's a factor, and how the number of people working in labs now compares with the usual complement of lab workers?
We've been able to bring in about 10 additional people to help with certain key components of the testing and specimen logging in, data entry of the process.
Mm-hmm.
Because of the skill set that's required of our laboratory scientists, we are not actually able to very quickly incorporate someone who has no laboratory skills. There's a lot of functions that can be performed up front before the testing takes place, which takes a lot of time. But when it comes to the testing process, we really, so far, have been drawing from other areas of the laboratory to help us with those steps.
Thank you.
Dr. King, what kind of statistical data is being collected about the patients?
So those are mostly demographic information that positively identifies the patient. So there's many similar names. We need several identifiers to make sure that we are actually reporting this on the patient as opposed to someone who might have a similar name or a similar date of birth. With this kind of massive testing effort, that's even more important than it is on a regular basis. Another piece of information that's critical is how to contact the patient. So phone numbers in the past were not nearly as important as they are right now for each patient. So that's something we also entering into our data system. Their primary care physician is another piece of information that we would like to have because we have to report that results to the patient's physician in addition to the health department.
And as a part of this contact tracing process, CAID, the Center for Acute Infectious Disease and Epidemiology, do interview all the positive cases, and then they collect additional demographic information based upon those interviews.
Thank you.
They're interviewing every single positive?
Yes. Yes.
Wow.
It's a huge effort. So once the lab result is reported, that's really just the beginning of a very extensive contact tracing effort.
And sorry if
you talked about the shortage of the reagents. You also have a shortage of swabs. Do you have enough there?
That was certainly something that was a concern early on, where everyone was trying to order those swabs. At the moment, and actually we have the National Guard helping us procure, store, and distribute those swabs to all the testing, what's called the testing sites, but more accurately specimen collection sites. So those are, at the moment, the state has an adequate supply. Again, we're using quite a bit every single day, thousands by now. So that remains an important function. But right now, we're not experiencing a shortage.
Ron Perkowski, Workforce. Could you tell me how long you expect to need to continue at this rate, and whether you feel you're likely to be able to do that without additional resources with personnel or equipment?
Well, a lot of our personnel are working 10, 12, 14-hour days sometimes in order for us to respond adequately to this to the coronavirus. The last time I saw data for Rhode Island, the expected peak was going to be April 19th. We'll see if that still holds. We have a lot of very dedicated people. This is the job we signed up for. So there's not going to be any drop in effort from us in this response. We've been very lucky where we haven't had anybody be sick who works in the laboratory, but we have things in place so that we could deal with that if that were to happen. So we think we have adequate staffing to get us through the response.
And just to be sure that's through at least April 19th?
Well, those are the modeling, some of the modeling that predicts.
Well, that's the peak. So then we just still have to go down the other side of the slope. So it's going to be we're still going to be doing in this process for quite a while, we expect.
And to clarify, there are multiple models that don't agree on when the peak is going to be necessarily. So we really don't know how long we will be required to operate happen. But we feel confident that we have enough trained staff to continue for quite a bit longer, as long as needed.
Mike Healy jumping in here. Just want to make sure that every reporter who's on the call has a chance to ask a question if they want to. How do folks feel? Because I also want to respect the fact that you got to get ready for
You are muted.
Governor and Dr. Alexander Scott's press conference in about 40 minutes or so. Is everybody squared away?
Good to hear, Mike. Thank you.
Yep.
One last. Oh yeah, you bet. So one last housekeeping item. I've got about maybe 10 to 12 requests for the still photographs. Michael Delaney, the photo editor at the Providence Journal, asked if I would centralize those into a couple of emails as soon after the call as possible. So if I think I've responded to everybody so far who's asked. And I will forward that email along to Michael Delaney shortly. And I will see to it that everybody gets those photos as quickly as possible. Dr. King and Dr. Huard, really appreciate your help and time. I think it was a good conversation, and to give folks an idea of the challenges that are posed by this pandemic, and I do appreciate all the help of reporters. I have to say, I think our press pool's done a really amazing job of covering this crisis, getting out a lot of great information. So thank you very much.